A cry for dignity in white coats. Addis Ababa, Ethiopia. In a powerful and urgent appeal, the Ethiopian health professionals movement has issued a 10-day ultimatum to the Ministry of Health, demanding long overdue reforms to address the dire conditions faced by the country's health workers. The open letter, released over the weekend, outlines 12 specific demands, echoes of grievances voiced repeatedly over the past 2 years. The message is clear. If the government fails to respond by May 11, legal action will follow. The letter, signed on behalf of health professionals nationwide, paints a grim picture. Low wages, lack of housing, inadequate medical coverage, and a life described as below human dignity. Despite years of service, often under dangerous and under-resourced conditions, Ethiopia's frontline caregivers say they are being exploited and ignored. This latest warning comes amid a growing digital campaign under hashtags like #HealthWorkersMatter, #PayHealthWorkersFairly, and #HealthForAll. The campaign has galvanized support across the country, with health professionals sharing personal stories of hardship and sacrifice. One professional told Addis Standard, "This is not political. It's about rights. Our income doesn't match our workload or the cost of living." Perhaps the most heartbreaking revelation in the letter is the reality that some health professionals are dying due to lack of treatment, while others are forced to beg publicly for medical care. Because we are health professionals, we have been forced to bow our heads and live a life below human dignity, the letter states. #the demands. Among the 12 demands are a salary averaging $1,000/month, aligned with East African standards. A 45-hour work week with proportional overtime pay. Hazard pay, transportation, and housing allowances. Free medical care for health professionals and their families. Accountability for harassment and abuse by authorities. Establishment of international exam centers in Ethiopia. A merit-based system for leadership appointments in health institutions. The letter also condemns media misinformation and calls for legal action against those spreading false narratives that undermine trust in health workers. #A sector in crisis. Despite a flood and retain policy aimed at rapidly expanding the health workforce, Ethiopia continues to face critical shortages of doctors, midwives, and other professionals. Many newly trained doctors remain unemployed, while others are leaving the country in search of better opportunities. In rural areas, the situation is even more dire. At Kamba Primary Hospital in South Ethiopia, staff resigned en masse due to unpaid salaries and administrative abuse. In Mekelle, employees at Ader Referral Hospital went on strike earlier this year. The letter ends with a somber reflection. We have neglected our own lives while being engaged in saving human lives for so long. It calls the government's silence an unforgivable mistake for the generation.